Okay guys, just walking down to the beach and want to do a quick Kybella fat removing video. So Kybella is deoxycholic acid, and it's a fat dissolving injectable that is commonly used under the chin for the submental area. Okay you guys, so this week's video is gonna be vlog style just because I'm a mom of 2 kids and it's summer and school's out and the kids have so many different activities, and I balance life through family, career, and trying to make these videos for you guys. So this week's video is gonna be vlog style. So yeah, bud.
I'm ready for dinner.
Okay, I'm gonna feed my son dinner. We'll pick this back up in a second. Okay, so he said he's ready for dinner and he's not down yet. We just came back up from the beach, which is why I still have my little bathing suit on. So Kybella is an injectable fat dissolving solution. It's called deoxycholic acid, and we use it a lot in our office because it's really good at removing stubborn areas of fat where diet and exercise alone won't touch. So even my patients who have had dramatic weight loss, with exercise, with changes in their diet, and even some who are on medication for weight loss like GLP-1 agonists, there's still like certain areas that our bodies, especially as women, like to hold on to fat, usually on like the lower abdomen, sometimes on the backs of the arms, bra fat, back fat, even above the knee. And Kybella above the knee is like the most random place, and that area of fat pockets actually really responds well to Kybella. And the reason why I like Kybella is because it is not as aggressive as like liposuction or CoolSculpting, and it doesn't have a lot of the side effects that you see associated with liposuction and CoolSculpting. Liposuction, is done under either tumescent anesthesia or general anesthesia in an OR setting by a plastic surgeon, and comes with its own risks, and also can have irregularities in the distribution of the fat after liposuction. So when the plastic surgeons use a cannula to suck up the adipose tissue or the fat, there can be tunneling and kind of bound down scarring in the areas that are treated with liposuction that causes like irregular shelving and irregularities in the fat distribution. Now, if someone has a lot of fat to remove, of course, liposuction is preferred over Kybella, but Kybella is also used to kind of fix those little areas after liposuction that are irregular with like little pockets of fat that weren't adequately treated. So it's not a substitution for liposuction, but it's for little fine tuning of areas of increased fat. So we have 2 cats and a dog, and they're just running around like crazy out here. I have to show you guys. Toby! Hi, Bubba. You ready? You ready for dinner, bud? So I really like Kybella for people who have had liposuction and have those little irregularities where they'll have like a fat pocket still here or there, or an area that has more, kind of like volume after liposuction where the other areas are more flat. Also for people who don't have enough fat that would, kind of warrant a liposuction procedure, Kybella works really, really well. So CoolSculpting is the other fat reducing device, which I used back in the day, back in like 2017, 18, 19, but we had a lot of complications with it. You have paradoxical hypertrophy of adipose tissue, meaning you can get fat in other places after CoolSculpting, which is a really unfortunate side effect. You can also get that with liposuction. There's also like a draw of the skin being treated for decreased fat, and the draw of the skin into the device can stretch out the skin. And that actually happened to me after my second pregnancy, after I had my second baby. I remember I did CoolSculpting in my lower abdomen, and I had like laxity in the lower abdomen, and I didn't ever want to have abdominoplasty or tummy tucks. I didn't want that scar. And of course I had to do thermage and Sculptra to kind of tighten that skin up, which worked. But it's a side effect that you see with CoolSculpting, which is a minimally invasive in-office procedure for also fat reduction, but just comes as, in my opinion, in my professional opinion, just too many risks and side effects associated with that procedure. So Kybella is great because you can kind of just spot treat it. It's done in the office. It is a little stinging and painful, not from the injection so much, but because of the adipocytes, which are the fat cells, how they kind of disintegrate and get disintegrated from the deoxycholic acid. It's actually a painful experience. Now, pain is all relative. Usually people will say it's about 3 or 4 out of 10 on the pain scale. Some people who have a lower threshold of pain may say it's a little bit more uncomfortable. Some people are like, I don't even feel it. So it all just depends on, your own pain threshold. Women usually tolerate pain a lot more than men, especially when it comes to beauty procedures. But for the most part, the discomfort that happens is because those adipocytes or fat cells are disintegrating from the deoxycholic acid. It can cause a little bit of swelling, and then your immune system comes and kind of clears it out, and you excrete out out the byproducts in the urine. Because a lot of people will say, well, what happens to that fat? Is my cholesterol going to go up? Am I going to have like a, cholesterol or fat embolus in the Am I going to have a cholesterol or fat embolus in the, in my arteries or vessels that's going to have any, side effects or catastrophic effect like a stroke or an MI? And that's not the case. You basically just excrete out the melted fat after it is just dissolved with the Kybella or the deoxycholic acid. So oftentimes we'll combine Kybella treatments with skin tightening. So sometimes when you melt the fat, my daughter's here playing with the kitty. As you guys have noticed, I don't post my kids anymore. Just in the world we live in today's times with AI and everything, I just don't post my kiddos anymore. I wish I could because they're super cute, but Rara, what are you doing? So what happens is after the fat melts, fat is a volumizing component under the skin. So when you remove fat, sometimes you can have a little bit of skin laxity. So depending on the patient's skin turgor, say we're going to treat abdominal fat or, underarm fat or bra fat, the skin in this area and on the back is usually a thicker dermis and epidermis, especially that reticular dermis, which is a lower portion of the skin. Your back skin is thicker. And I only know this from being a skin cancer surgeon for decades, and we'd have to use a totally different scalpel when we do excisions of skin cancers on the back versus other areas of the body, but it's actually more forgiving. So if you're melting fat like in the back or the kind of flank area, or to kind of like give the hourglass shape, like usually like right here, you usually don't have to worry about any laxity. Also, lower abdomen, depending on a woman's age or how many babies she's had and things like that nature, you usually don't have to accompany skin tightening with Kybella, but it's always something to keep in the back of the mind, and it's not something that should deter you from having Kybella. Because say you melt your fat in your abdomen and the skin's laxed, we could do Sculptor, which is a biostimulatory filler. You could do Radiesse, which is also a biostimulatory filler. You could do Ellacor, you could do CO2, you could do Fraxel, you could do Thermage. There's so many things you could do that shouldn't be a concern when it comes to using Kybella to melt, like for example, abdominal fat. And it should, skin laxity post fat removal with Kybella shouldn't be an issue that you have to worry about with back fat and bra fat, because the skin in those areas doesn't usually typically present with laxity when there's that volume depletion with fat loss. So what to expect when you have a Kybella treatment in the office? What typically happens is you come in and you kind of pick out the area where you're interested in melting fat or reducing fat. And usually a 1 vial of Kybella will treat a surface area about this big. So if it's like abdomen, or if it's like inner thigh, or if it's like flank, usually it's 1 vial per treatment area. And as a provider, just being in practice for almost 20 years now and be very experienced with this procedure, I don't usually give a patient more than 4 vials at once. Typically we'll do like 2 in the abdomen, 1 on each arm, or we'll do 2 in the submental area, and then maybe 1 on the upper abdomen, 1 on the lower abdomen. But I never do more than 4 because there is, discomfort during the procedure. And sometimes like the more stress the body undergoes, the more, the patients may get vasovagal, which means you kind of like, it's a lot to handle sometimes. And I feel that even my strongest patients, 4 is kind of like the limit. So I never do more than 4 vials at a time. I'd rather someone come back and get 4 individual treatments with 1 vial, or do 2, vials at one time and another 2 another time. Just 4 vials is kind of my max. I have a lot of colleagues and other dermatologists who I know who will do more than 4 vials. I just personally, and I've had this treatment done myself, and so I just think that the amount of Kybella and discomfort that it causes is directly proportional to kind of your tolerance and how you feel afterwards. But most patients after the Kybella treatment will just walk out. You can just go to the gym right after. It's so noisy in here. Sorry, I need to get my mic, guys. But most people can just walk right out of the office after having the treatment, and they just go along with their with their schedule, and they can just go to the gym, or there's no downtime, which is really nice. Now sometimes you can have bruising or swelling that takes place, but when you do Kybella for body contouring, the bruising and swelling is usually not as significant. When you do it under the chin, like for the double chin, that swelling can be pretty significant. So you need to appropriately schedule those treatments, because having swelling in the submental area is very unfortunate, because you literally look like you have like a double chin. Hey guys, kids are fed. Justin's out playing basketball. I'm gonna go and have a little relaxation time in the hot tub. So I miss doing these vlog style videos with you, but it actually gets it done, and it is a lot easier for me to just cram it into my schedule and just connect with you guys. So I wanted to continue talking about Kybella for body contouring and also just kind of get into the pathophysiology of why sometimes as women we hold on to fat in certain areas that we didn't before. Okay, so during the perimenopause period, which now they're discovering so many different aspects of menopause and the duration of how long it takes, and the perimenopausal and postmenopausal period, this can last like a decade. It can start, anywhere in our 30s and go to anywhere in our 50s. So there's like anywhere from 35 to 45 or 45 to 55, and there's such a huge variety of these pathophysiologic changes that happen in our bodies as women with hormone fluctuations, that it's very multifaceted, and there's a lot more research and education and I think attention into this like specialized area of medicine, which was often just kind of like ignored in the past. But in perimenopause, the body and the hormones hold on to adipose tissue and fat in different areas than it did before. Like you go from the hourglass shape to the more like kind of soda can shape, which a lot of the plastic surgeons refer it to as, and you get fat in weird pockets that you didn't have before, like we talked about in the lower abdomen, even like above the knee and the medial thighs. And so it can be frustrating for somebody who's been, fat, fit and, very regimented with their exercise and diet, and then all of a sudden you are holding onto fat in areas that you didn't have before. And I think that Kybella has really played a role, at least in my office, for helping women kind of just combat these little annoying, stubborn areas of fat deposition. Now, it can happen in men and women of all ages too, as well. Sometimes you just physiologically and genetically are, holding onto fat into certain areas of your body that, no matter how much you diet and exercise, just won't go away. And a lot of that has to do with like an evolutionary kind of survival mechanism for storage of energy for when you're in a feast or famine kind of situation. So I think that just depending on your body type and your genetics, or maybe it's just stubborn areas of fat that, just really don't go away. And I think Kybella is a really great treatment to kind of help get that under control, especially when you're, leaned out and exercising every day and you really don't have much room to improve on your diet. Now, many patients ask, well, if I have a Kybella treatment, how long does it last? And I remember when Kybella was first launched, I was a resident still at the time at UCLA. This was like back in 2008 to 2000, probably 12 or 13. And I remember Dr. Frederick Bedingfield, who was my attending at UCLA, was one of the pioneers of, and also Dr. Adam Rotunda. Dr. Rotunda, if you're watching this, I just remember as a resident just being in awe of this, this new treatment that was produced by Allergan, and the clinical trials that showed that it was an injectable fat dissolving solution, which was very, very exciting. But a lot of people asked, well, how long do the results last? Now, I'm not sure. The clinical trials, I believe, went for either 1 to 1.5 years. So for a long time, we would tell patients that, once adipose cells are destroyed, you can't make new adipocytes or fat cells. But the existing fat cells that you have can get larger or smaller with weight gain or loss, depending on your diet and exercise. So technically, the board answer for that question is, how long does Kybella last, and do those fat cells ever come back? The answer is no, those fat cells never come back, and the results should be sustainable and last a lifetime. But what we've noticed is adipocytes the fat cells that remain can get larger and smaller depending on fluctuations in hormones and weight. So I would say typically when people come in for a Kybella treatment for a stubborn area of fat, as long as they maintain their diet and exercise regimen and they don't have a huge, swing in their weight, the results from Kybella can last several years. I would say on average 4 to 5 years. And even for myself, I've done Kybella on my abdomen and on my medial thighs. And I say I probably have to do it every 3 to 4 years. And that's just been my experience with it. But everybody is different. Hi, my beauties. I'm literally sitting here in the hot tub filming a YouTube video vlog style because with the kids out for summer break and, they have so many beach activities and surf camps and junior lifeguards and volleyball camps, and between the skincare line, also exciting news, we're formulating a new sunscreen that will hopefully launch within the next, month or so. There's just so much going on, and obviously seeing patients in my office, it's just hard to find time to carve out to film these videos. So I'm actually filming that for you guys right now. And am excited to show it to you guys this week. So we're going to be talking about body contouring and fat melting with Kybella. So stay tuned for that. And just want to connect with you guys because things have been a little crazy, but it's summer and I love summer and it's just been so much fun, but just I feel like a crazy person just trying to cover all bases here. Okay, you guys, so just winding it down and doing my nighttime routine. And just wanted to finish up by saying a couple other points about Kybella. A lot of people ask how many treatments are usually necessary to get to your endpoint goal. And I would say on average, it's about 2 to 3 treatments for body fat contouring. And it could be just 1 treatment, it could be 2, it could be 3, it can actually even be more. And when you look at the literature, some providers recommend, like 5, 6, or 7 treatments. So that's like across the grid, very variable from clinician to clinician. But typically in my office, I would say the average is 2 to 3 treatments, about 6 weeks apart for best results for body contouring with Kybella. Now the submental area, or like the double chin area, is a little bit more recalcitrant. Recalcitrant in medicine just means really resistant to therapy. And sometimes the submental fat, it takes a little bit more treatments and more vials of Kybella depending on how much adipose tissue is there. Now, you also have to remember to go to someone who is highly trained, because if they inject in the wrong area, the nerves that innervate the face are ensheathed by something called a myelin sheath, which is composed of fat. And when people are cavalier about injections and don't have the proper training and know their anatomy very well, and they're like injecting in areas of the face here, right where like the marginomandibular nerve is and where the facial branches of like the facial nerve are, you can actually cause nerve damage. So just make sure you go to someone highly trained. This video is more for like body contouring with Kybella, but for a submental area, for the double chin, just make sure that you go to someone who knows what they're doing and knows the proper placement, because even the depth of the injection of the Kybella is very important, because if you go too deep, you can attack fat that you don't want to be addressing. You want the more superficial fat. And also, if you're too superficial or you're not giving it in aliquots at a proper volume, it can like ulcerate the skin or cause like really bad side effects. So for most parts, for body contouring, about 2 to 3 treatments spaced 6 weeks apart. And it takes about, usually the company would say it takes about a month to see results. But honestly, when I do it on myself, I notice it like 1 to 2 weeks later. So I'll be swollen and then the swelling goes away and then it just like flattens things out. So that's my experience with it as a patient as well. So usually I'm putting on my neck tight serum. You guys, this is amazing if you don't have this one for neck and décolleté. Oh my gosh, it keeps that skin tight. As far as the discomfort, when we say it's like a 3 or 4 out of 10 on the pain scale, we always say it's a crescendo, decrescendo. Like it's like, ooh, that hurts, it burns. It's like a 4 or 5 out of 10 and now it's going away. It usually lasts just a few minutes in the office, and by the time you leave the office, that pain has subsided. Now you're gonna be a little sore from the injection sites and the needle sticks, but you could just seriously go to the gym that afternoon and you're not even gonna like be worried about it, and you won't be in much discomfort. The most discomfort happens as the fat cells lyse, L-Y-S-E in science means when they explode pretty much. And after those cells are, destroyed, that's what causes the pain. And then the pain subsides within, 5 to 10 minutes. So it's not a long duration that you're uncomfortable. I'm putting on my NF hydrator. So usually that's pretty much it for the long and short for Kybella. If you guys have any questions or I forgot to leave anything, if I left anything out, just let me know. But it's a quick and easy procedure. It's a great way to get your summer body ready. It's very low risk, especially on the body, but of course you have to go to an astute provider who knows not to put it in the wrong area. For example, for brow fat or fat in this area, there's the axillary vault here underneath the armpit where there's a lot of nerves and vessels and arteries that run there. So, someone who knows their anatomy is going to know not to inject like too close to that. So, but for all intents and purposes, it's a very safe and easy and effective procedure. I'm putting on my retinol. So you guys, that is pretty much it for today's video. Let me know what else you guys want to hear about. I think a lot of you guys have asked me about EndoLift. I feel like that's something that a lot of you guys are asking me about. So if you want to hear about EndoLift or if you want to hear about anything else. Oh, also I got started on a bunch of new supplements by my holistic doctor who actually started me on NAD, subcutaneous injections, and a bunch of other really cool supplements too. I can do a supplement video, an updated supplement video, because I've changed a little bit of how I'm doing my supplements as well. So EndoLift, supplements, anything you guys want to hear, drop a comment in the comment section and let me know. Because I hear you, I see you, and I want to connect with you, and I want to give you all the education that you need in whatever subject of dermatology or aesthetics or health that you want me to talk about. All right, guys, I'll see you next week. Good night. Ready for bed. Let's just see how this mic works, and then also what I would look like if I didn't have a filter. It's kind of terrifying. But I don't know if my mouth looks any better or not. It kind of looks a little bit better. Okay, let's see here with the mic. Thank you so much for watching. Drop a comment in the comment section and share this video with someone who may find it useful. As always, I love you guys.